I'm gonna get the capitis as well. And when you do, you can see that scapula really gets away from that thorax. We see that. All right, the first muscle I want you to see in this group is this big flap right here. There's a flap of muscle that separates the scapula from the thorax, and it goes all the way to the ventral side. Okay. This one gets its name because it has many heads to it, and it looks like it was serrated, like it was chopped up. Can you find it on your list?
Wait, I'm looking at this right now.
So it goes more to the ventral, so it's the serratus ventralis. Very good. It's this big old muscle right here. Your serratus ventralis is also known as your boxing muscle. So what do you think this is doing for you? And look where it's attached. It starts at the scapula and goes to the ribs. Yeah, exactly. It is protracting the shoulder blade. Okay, so when you throw a punch, you're using this muscle to throw your shoulder forward. Okay, serratus ventralis. Everybody see that? Easy way I remember this one, I think it looks like a paper fan. Okay, and fans vent. It's the serratus ventralis. All right, now please do not get this one confused with this muscle right here that we already covered. What's this muscle? Subscapularis. Sometimes I'll put it, well, when I put a flag here, sometimes students will think that's the subscapularis when it really is the serratus ventralis. If you can get a finger underneath it, serratus ventralis. Subscapularis you can't. It is bound to the bone. All right, good with that one? Yeah. Okay. All right, the next muscle I want you to find is going to be very thin. It's going to act as wallpaper. There we see this muscle right here. Okay, flip it around. There we see this muscle right here. All right, here's the border. I'm going to get underneath the border and peel this muscle downwards. All right, so this wallpaper right here is your serratus dorsalis now. And you can see it stops right here. It's more dorsal, while the ventralis goes more ventral. So I'm going to peel that down. You really have to get underneath some of this fascia right here to do it. Gently peel it down because there's muscle underneath that we need to see, but I also want to keep it intact so I can practice with it. All right, and if you peel it down far enough, you're gonna get to a muscle that looks like bacon. I see bacon down there. You don't see bacon right here? It's got little fat deposits in it and everything, just like cartoon bacon.
I'm going along with it, yeah.
Okay, thanks. Appreciate it. Okay, so here is your bacon right here. The little fat deposits. Bacon. Little fat deposits in it. Okay. Right here. Okay, good. At least somebody does that. Alright, so this is the first muscle that we need to talk about on the innermost layer. So this one gets its name because it goes over all these bones down here. What bones do I have right here? Your ribs, very good. And it goes all the way down your body and then inserts on the ilium at the os coxa. Can you find the name on your list? Yeah, it's called your iliocostalis. Very good. So the bacon is the iliocostalis right there. I like food. All right. There's going to be 3 lines of muscles here. The iliocostalis will be the first one. Now I'm going to get the second line out. There might be fascia over it, so you have to clean it up a little bit. All right, this next muscle up is the longest muscle that we have in the body, and they were nice enough to put long in the name for you. Can you find it? Yeah, this is called the longissimus dorsi. It goes down the entire length of the body. Okay, so that's the next row. And then the top row actually has 2, so let me separate those 2 real quick. Okay, that's good enough. All right, do you see the 2 on the top row? Okay. There's a 2 on the top row. All right, one's closer to the head, one takes up more of the spine. All right, so again, what was this long one right here in the middle? Longissimus dorsi. Now the one above it that is parallel to it also has dorsi in the name. There's 2 dorsis right next to each other. But this one's touching the spine, so this is called your spinalis dorsi. Okay? So that's your spinalis dorsi here. And the one in front that's kind of triangular shaped right here is called your splenius. Spleni means bandage in Latin. They thought it looked like gauze on a human. Yeah, so that's where that name came from. I don't know if that'll help you or not. All right, let's recap these real quick before we move forward. What is this big flap right here? Serratus ventralis, good. What was this wallpaper here? Serratus dorsalis, good. Underneath the serratus dorsalis, we have bacon. What's the bacon? Iliocostalis. Above the iliocostalis, we have the longest muscle in the body. Longissimus dorsi. Parallel to the longissimus dorsi, touching the spine, is the spinalis dorsi, and then the triangle towards the head is the splenius. Good. The last thing you need to do, your longissimus dorsi, this is the anterior perspective, right? This is going to be more posterior. In the anterior, the longissimus dorsi is a single muscle. About right here, it forks into 3 different heads. So I want you to see these 3 different heads by cutting a window in this really thick fascia here that I told you to leave before. So remember doing that. All right. So you don't have to be gentle with this. Just cut a nice big fat window. There's probably multiple layers of fascia that you have to cut through to get to it. One layer of fascia. Let's cut that away. Some needle fluke out of the way. Okay. Here are the 3 heads. So they call these heads bundles because they can work independently. Let's talk about the names of these bundles. What would you name this bundle right here and why? That's your medial bundle. How'd you know that? Yeah, it's towards the midline. So you see that. Which means you have 2 lateral bundles. What would you name this lateral bundle right here? So it's above. Right, that's the upper lateral, while this one is the lower lateral. So we have a medial bundle, we have an upper lateral bundle, we have a lower lateral bundle. Okay? Now again, what muscle is this to? Longissimus dorsi. Again, at the anterior, it's a single muscle. It's about right here. It forks into these 3. Okay. Now the last muscle, once you get the medial bundle out, push it down, and there's going to be a muscle that is directly touching all the vertebrae right here. That's deep in fascia. You will not be able to get this off the vertebrae. It's very tightly bound to it. And that's because there's a head for each vertebrae all the way up your spine. It's a lot of different heads. Actually, where the name came from means multiple heads. Yeah, it's called your multifidus spinae, which means many heads for the spine. Yep, multifidus spinae. All right, so recap real quick. What's this right here? And this one? And this one? And to what muscle? Yes, the longissimus dorsi. And then what's this muscle right here? Multifidus spinae. That's everything we're covering today.